Hi, my name is Ivy Clinton, and today I'm going to talk to you guys about burns. So first off, I just want to see how many of you guys have probably had burns. I know I've had a few burns. I've had sunburns from being on the sun for too long or forgetting to put on my sunscreen, or I've had burns from having too hot of water in my shower and I touch it and it's really hot, so I flinch really fast for my hand to go back. So, what are burns? Burns are a type of injury that occurs when your body comes in contact with something extremely hot, such as like a hot stove or a really hot coffee that your parents might drink during the morning. There are actually three different types of burns, well, different degrees of burns. So the first degree is it only affects the outer layer of skin that's damaged. So that could be like a sunburn. So when you're out in the sun for too long, say you're playing out with your friends in the neighborhood, and then you stay out in the sun, you forget, oh, I forgot my sunscreen, and you have that burn afterwards, maybe the next day, that's a first degree burn. Second degree burn is when the outer layer of your skin is only affected and maybe a little bit deeper into the skin. So, say it'll have maybe some blisters and some peeling over time, but it heals pretty quickly within 10 to 14 days. And then the third degree is deep skin damage. So, when your whole, say, I burned my hand and it's a third degree burn, it'll be pretty much my whole outer part of my skin and also what's underneath the skin as well. And it'll probably be like a dark brown, dark red color, and it'll look really damaged. So, what could cause burns? So, there are four common types of burns that can happen from different causes. So, the most common cause of a burn is thermal, which means if you're like exposed to a big fire and you try to touch the fire, it'll burn your hand, or if you come in contact with something really hot like a stove, like your parents always tell you, don't touch the hot stove. You better stay away or you get burned, and that's why. And then another form is chemical burn, which is a type of burn where you either touch or you eat something really bad, such as bleach, which tastes really gross. And even if you get it on your skin, it irritates your skin really bad and burns it. Another form of a burn is electrical, which is exposure to electric currents. So as you can see, I have a picture of a power outlet and a power cord in this presentation, and I just want to warn you guys to stay away from those, because if you put something, let's say metal like a fork, into the outlet, it can cause a really bad burn and you can go to the hospital. Or if you try to bite down on one of the cords, then it's going to hurt really bad as well. And then another form or another cause of a burn is radioactive, which is contact with radioactive items. Now you're probably thinking, what's radioactive? It can be anywhere from, like, say in the microwave, there's like little waves and stuff, and you see it heating up your food. Well, it's also the same with the sun beating down on you, and it's caused by the sun. So that would be example a sunburn. So what happens when we are burned? So as I said before, there's three types of degrees of burn. So first degree burns, when you get a first degree burn, it's painful to the touch. So you want to make sure not to touch your burn or anybody else's that might possibly have a first degree burn. It'll make your skin really red, kind of like a cherry. And then also after a few days, it'll start peeling off a layer of your skin, which might sound gross, but it's actually a good part of your healing process. That way you get new skin underneath. A second degree burn is painful to the touch. So as the first degree burns, make sure you don't touch them. They might have sensitivity to cold air. So say you go outside in the winter time, such as like right now, it's almost Christmas time, so you go out, but if you have a second degree burn, it might not feel so great. So you want to make sure to cover those up. You also might have bumpy skin, so if you want to feel your skin, it's kind of smooth, but if you have burnt skin, it might feel like dry and rough and bumpy. And then also, as the first degree one, redness on skin and peeling after a few days. Now with the third-degree burns, these are very serious burns. They call they cause extreme pain. The skin may be brown or black and deep red color. It might cause extreme peeling, and also it could cause loss of feeling. So if you touch that burn, you won't be able to feel anything until it's fully healed. So I have some images here of the degree of burns. So for the first degree burn, I just have a picture of a kid who has a sunburn all over their face, and you can see where it's kind of red and it's kind of like discolored, like around her eyes they're white, and around her mouth it's white, but everything else is red, and it's going to be really hot to the touch and also really painful if you touch it. The second degree burn is a little more severe than the first one, or worse. So what it has is, see here we have a hand, and on the hand there's blisters and red spots on the hand, and it's going to be really hard to the touch and really dry and blistered, and it's going to be pretty painful, but luckily it'll heal up in a week or two. And this is a third degree burn, and it's shown on a leg, like your upper thigh. And see how it's kind of brown and it's black in the center and it's red on the edges of the burn. That means that it's severely burned because it's so damaged. But luckily we have different things that we can do for these third degree burns that help them heal really fast and hopefully really easily. So how do we treat these kinds of burns? So for example, say you have a sunburn, usually probably what you do is put lotion on it and maybe put some alloy lotion on it, which cools your skin down and it feels really, really nice. Or maybe in a second degree burn where you have blisters and stuff, and making sure, like say you have blisters on your hand right here and it's like all bumpy, that you make sure that you cover that wound and make sure that it doesn't get infected, which makes it even feel worse than it already does. But for really severe burns, such as the third degree burn, you might have to stay at a hospital for several days to help treat these burns. And so while a child is at the hospital treating these third degree burns, they have to go through medication to help with the pain because it really, really hurts, and also help with the healing process. That way you can get your new skin back. Also, they have to have bandages that cover up the burns, so it can cover the hands or the arms, and it's like bandages, big gigantic bandages that they wrap around your arm like that. Also, they might have to take a shower or a bath called a hydrotherapy bath to help clean the body. And also, they might have skin grafts, which I'll explain a little bit later. So after treatment is done at a hospital, a person may have to go back to the doctor's office several times and make sure that the burn is healed well. And they also might use a pressure garment that is used to help heal the burns. So this is a picture of a skin graft. So the skin graft is where they go to a different part of your body and they try to use this mesh-like material, like kind of like fish scales it kind of looks like, and it helps heal the skin so you can have even more protective and more sturdy skin than you did before. Also, there's pressure garments that a child or a person may have to wear in order to heal their body. So you can see here, there's some that you can wear on your hands, on your legs and feet, and also around your chest. That way you can heal faster and better and make you feel good as well. So what should you do if your classmate maybe has a burn? Maybe they had to stay at the hospital for a long time and they just came back to class, and you're kind of feeling iffy because they're different because they have maybe a burn on their arm or their chest or on their neck. And so a good way to communicate or talk to your classmate would be just to treat them like anybody else in the classroom. Everybody wants to play, and they might seem different, like say they have a burn on their arm, they might look different with their arm, but they still are able to play, they're still able to talk to you and everything that any other classmate would want to do. make sure that you ask before talking about their burns. So it's okay to ask like what happened with your arm with their burn, but if they don't want to talk about it, then they're probably not ready to talk about it. And we shouldn't bring up that topic again just so we don't hurt their feelings. Also, don't tease a child. We don't, just because someone's skin might look different, maybe it looks bumpy and not smooth, or maybe it's really red and yours is not, doesn't mean that they're any different and they still have the same feelings as you and I. And if they need help with anything, don't hesitate to lend a helping hand, because they're always need of a helping hand, especially through this traumatic experience that they went through with burns. And that is the end of this presentation. All I would like to leave you with is be kind to each other no matter what they have been through. So no matter if they're different from you in any sort of shape, way, form, whether they have burns like we talked about, or maybe they are in a wheelchair and they can't walk, or maybe if they can't verbally speak to you, then we should always treat kids just like anybody else. Thank you.